Hello everyone. In this video, me and my postgraduate student Shashwat Pandya are going to demonstrate the sleeper stretch mobilization technique. This technique can be utilized to treat frozen shoulder patients and help them improve the shoulder internal and external rotation ranges, as well as improve the quality of sleep by relieving shoulder pain which occurs frequently at night. The technique can also be taught to the patient to be performed as an home exercise. So to perform the sleeper stretch mobilization technique, the patient is going to be made to assume the side lying position in such a manner so that the affected side shoulder joint remains towards the couch. So for demonstration purpose, let's assume that this patient is experiencing pain and restriction of motion on the right side shoulder joint. So in this case, the therapist is going to make the patient assume the right side lying position. Now the patient is going to lie in such a manner so that the shoulder is cleared and is kept in a range of abduction with neutral rotation, and this is going to be supported with the other side hand. Similarly, the lower leg is going to remain flexed at the hip and knee by 90 degrees and the upper leg is going to remain extended. Now with the patient positioned in this manner, the therapist is going to utilize a mobilization belt, and this is going to be placed over the plantar aspect of the foot like this, and then we are going to take this up and bend the leg so that we can actually take this belt as close to the shoulder joint line as possible. So this is going to be our belt placement. And from here, the patient is going to be instructed to push down on the belt using the foot, thereby delivering an inferior glide to the shoulder joint. And with the glide maintained, the patient is now going to use the other side hand to produce the shoulder external rotation movements. And similarly, the hand can be placed on the other side to produce the shoulder internal rotation movements. Now this technique can be combined by the hold relax or contract relax method to get best results. So let's say we have a restriction in the shoulder internal rotation ranges. In that case, after delivering the inferior glide by pushing down on the belt, the therapist next instructs the patient to take the shoulder into the available range of internal rotation. And let's say we have a barrier right here. Now instead of crossing the barrier, the therapist is going to instruct the patient, okay, now I want you to start taking your hand back to the neutral position, but that effort should be resisted with the other hand of the patient. So try to go back, and this is going to be the resistance. 1, 2, 3, 4, 5, 6, 7. And as I say relax, as the therapist instructs the patients to relax, he is only going to relax the effort of the affected side shoulder joint, while the left hand of the patient is going to take the shoulder joint into the newer ranges of internal rotation until a new barrier is met. The same thing can be done for improving the shoulder external rotation ranges. So do try this technique on your patients and also prescribe it as an home exercise. And this is going to help a lot in managing the shoulder pains as well as improving the shoulder internal rotation ranges. I sincerely hope that the information provided in this video is going to be helpful for you all. So see you all in our next video. Till then, keep learning, keep sharing, and stay connected.